A body can become strange before a person knows how to explain it. Before hospitals, before doctors, there was only this: a pain from nowhere, a fever in the night, a baby who would not stop crying, and someone wondering what the body was trying to say. This is where medicine begins. Not in a hospital, not in a textbook, not even with a doctor. Medicine begins when the body becomes a question. Something feels wrong, but the meaning is unclear. Is this harmless? Is this serious? Will it pass? Should I wait? Should I act? Every sick human mind reaches this point. Wait, act, or trust. The first question was not what disease is this? That came later. The first question was, what should I do now? And hidden inside it, who can help me understand this? When the body becomes confusing, we'll look for someone who can read the signal. For most of history, people had no scans, ECGs, antibiotics, labs, or clinical trials. The body gave signs, but no explanation. Blood, heat, swelling, pain, weakness, vomiting, confusion, breathlessness. These were not diagnoses. They were signs. And a sign is not an answer. Early healing was also a response to fear. A person in pain wants someone to say, this means something. We can do something. You're not alone. Ritual, touch, words, and repeated actions gave shape to fear. Not every ritual worked as medicine, but sometimes ritual helped the sick person hold fear. Even today, medicine carries some of that. A clinic room, a white coat, a prescription, a plan. These tell the frightened mind this is now inside a system. People experience illness from inside. Fear, urgency, and dependence. When something feels wrong, the mind looks for a story, safety, and a guide. That is human. Under uncertainty, we use shortcuts. They help us act before certainty arrives. But in medicine, they can mislead us. A fever may be simple or serious. Chest pain may be acidity or a heart attack. A headache may be stress or urgent. The body gives a signal, the mind gives it a story. The medicine begins when someone asks, is this story safe? Trust appears early in medicine, not after proof, before proof. Across history, people trusted healers, texts, hospitals, doctors, trials, and guidelines. Each age asked, who should read the uncertain body? Today, the patient has more information than ever, but not always more clarity. Search engine list possibilities. Reviews suggest popularity. Videos sound confident. Doctors may sound rushed. Tests look objective. But the patient is still asking, what should I do now? The tools have changed. The fear has not. Medicine began because humans were vulnerable. A symptom is not yet a diagnosis. A signal is not yet a story. Sometimes the first danger is the meaning we give it too soon. Medicine began when the body became a question, and every patient today is still trying to answer it.